worked once.
It always works so well when we practice, Breena.
I know. I'm going to just keep, I hope it works.
So Maria's having a little trouble with her computer, so she's trying to help.
Good. Okay.
Yep. And I will pull them up if you can hear me now. And so keep talking and I will work on it from my end.
Yeah, I think I'm good. Okay, so folks, this is the most exciting thing today is we have we've reworked our COVID website on the health department on healthvermont.gov. And what you see on this slide is the epidemiologic page that just goes deeper and deeper into the data, which I know many of you are interested in, and I certainly track every single day. It gets updated at 11 o'clock in the morning, which is new. Prior to that, it was 1 o'clock, and it just gets us in the thinking about where are the tests, where are the positives. I do want to caution you when you look at this type of test pattern that sometimes the number of tests is related to how much access we have to testing centers, and also the high numbers in Chittenden are partly reflective of the population, but also we've done intensive testing of long-term care facilities, staff, and all residents. So, 40, 50, 60 people in one building. So it isn't representative of a general population. I should have said this at the very beginning. Maybe you already have gleaned this from the fact we've had to talk to you a second time in 2 weeks. This situation changes every day. This virus was unknown to our scientists internationally until the end of December. So figuring out how it's transmitted, how people are affected, and how people recover is a daily experience. So I'm sure I'll be back in touch with you again before it's over. The general guidance stays the same, which you've been doing a great job with. The people that don't feel well shouldn't come, either as a staff person, a family member, or a child to your program. And if you've been in contact with someone with the virus, known tested positive, you need to self-quarantine for 14 days. And that means you should do that even without symptoms. It's important we continually remind ourselves of what it means to be in close contact. It isn't just the 6 feet, it's that you do that for a long time. So we talked about this together. It's not people that you pass in a grocery store and find out later were positive for COVID-19. So this is really about household contacts, intimate partners. And I do think within your programs, there will be, if we end up with positive cases, there will be close contacts to that person, but it won't be everyone in the building. It will be people that spent the day together for several hours. This is also just the same slide from last time. It's a lot to go over verbally, but I would keep this as reference. I think, Maria, we were going to tell you at the beginning, some of these slides are going to be available to you in lots of different places, including the CDD website, Let's Grow Kids website, Building Bright Futures website, the Health Department website, because there is some specific information here. And then there's also some links that obviously aren't live when we're talking this way. Looks like Maria is sharing, maybe?
Yeah, it looks like Breena, yours got stuck, I think. So I'll go through and share if that works, and then you can just let me know when to move forward.
Okay.
Would that be okay?
Terrific.
All
Sure.
right.
Okay, so we're on 2 more. Or 1 more. 1 more. And the next. Okay, so here's what's new, and the guidance came out yesterday. We worked on this over the weekend with our CDD colleagues, and we have it. It's the links in both our website and CDD's website are now the right link. But if someone sent it to you as a PDF, just make sure that you're looking at the April 6th guidance. And this reflects that the Center for Disease Control and Prevention came out with some additional guidance around care of children in these emergency situations, and just dove deeper into some of the specificity. So you're already doing daily health checks, but what's new is the cloth facial covering. We're actually being careful to not use the word mask, which of course it says mask here, But masks are meant for healthcare professionals, and we want you to use the cloth facial coverings to preserve the official medical masks for the workforce in the healthcare settings, but also because we feel that the cloth masks and coverings have more opportunity to be kid-friendly. This is sort of intuitive, and I know you've been doing it, but the gloves need to be changed in between children. The other thing I'll draw your attention to is at the beginning of this slide, conduct a daily health check for the children attending childcare, but you do the health questions with the caregiver. You don't ask kids, have you been in close contact with someone with the virus? And I know this language isn't perfect, but that is what we landed on because we didn't want you to be only asking caregivers. We want you to ask caregivers about the children. It's complicated. Okay, next slide. So here's a live link that will be available to you when the PowerPoint is posted, because there's actually pretty strong, clear guidance. You don't put a mask on and then pull it down to speak or to eat. If you're going to be eating, you should step out and do that separate from other people. There are a lot of resources about how to make your own masks. They're safe to be laundered and try to keep them in a reasonable shape. And at the end, we'll talk about how to get these resources to your programs, but Let's Grow Kids and the Child Development Division are working together with you and will be a resource for the material that you need to have the protection that we're recommending. Next slide. This is also new, and I really acknowledge quite cumbersome, but we're trying to get more organized around the way people arrive and get dropped off and picked up in your programs. So what's new is we would really rather there be a designated person for that activity. This is similar to the guidance that we give the general public about the stay home, stay safe, that there should be an identified person in a family that's doing most of the outside interfacing as it relates to pharmacies and grocery stores. So and I think families are already doing this to some degree. We also want, to the best of your ability, for there to be a place right upon entry for the hand washing. And if the sink is not near the entrance, then there should be a station with hand sanitizer. And maybe you could figure out a different entrance process that could be closer to a sink. And then finally, we are taking special precautions about children of healthcare workers. I think you were already asking about this. You guys asked great questions a few weeks ago. This is becoming more and more important. And if you have healthcare workers' children in your programs, we're available to talk through those cases case by case, but we really want you to give the advice which healthcare workers are receiving as well, that someone else could be dropping off their children. Next slide. Okay. In the likely experience that someone in your program tests positive for this virus, you do stop, at that point, you do take a break for a few days. And the reason why it's vague about 2 to 5 days is the health department will help you figure out who the positive case was, what the person's exposure was, and how long you need to stay closed. This is all new. Obviously, you would communicate that with the people that were involved, and there would be a thoughtful and thorough cleaning of your facility. And if in the, I know you're already doing this, but if there are people that are sick and staying home, or people testing positive and you're running out of workforce, we want to work with you on that and continue to keep track. Okay, next slide. So this got a little stronger in the CDC recommendation as well. We really want people to stay in their same group. I think you were out ahead of the CDC because your questions after last webinar reflected this question. And we sort of said, whenever you can or the best of your ability, keep groups together and separate. The nap time recommendation is to go head to toe, and the 6 feet apart for the mats. I recognize that there are limitations to your ability to do that. So this is all, we're all doing the best we can. That's the same with cleaning. Cleaning playground equipment is important anyway, and we're recommending through the CDC's alignment that we figure out a way to do that at least once a day. But keeping up with all the equipment and what needs to be cleaned is going to be difficult, and we'd love your questions on that for specific answers. We really are recommending you remove all soft toys and dress-up clothes and puppets, which is so sad because I love those toys, because they really can't be adequately cleaned during this outbreak. And then bedding is just, as I'm sure you already do, should be washed once a week. Next slide. A lot of you asked about this, and we're just going to tell you that the CDC changed the age cutoff from 60 to 65. I don't know why. I imagine it was in the context of data and understanding the way that this virus impacts folks who are older, and using the US experience and determining that 65 was a safe cutoff instead of 60. And they also, we did not include it in this webinar, but if you go on to our guidance, there's a little bit more about cleaning and a little bit more about food prep, but it's all very similar to what I've already described in terms of masks or facial coverings and cleaning supplies. Next slide. So just a reminder, we are still saying no more than 10 individuals in a classroom. That includes your teachers. To not be tempted to put groups together, to continue to practice great hand washing. I can't wait to see what we're able to do together as a society when this is over, when we've all become so much better about hand hygiene, because we really have not done adequate infection control in our environments prior to this. So I'm trying to find some silver linings here. And that no outside visitors and volunteers, and continue to clean as you have been. Next slide. We are still available to you between 8 and 3 during the week. If you're leaving messages and not hearing back, or if you're having questions on weekends, we are checking the mailbox once on Saturday and once on Sunday, so you won't be left from Friday night all the way till Monday if something is urgent. We recognize this new guidance is going to lead to more questions, and our full commitment to you as a maternal and child health division is that we've got your back, we're here for you, and you're not alone. Next slide. I said this earlier, but here's just confirmation that we know that your supply questions are going to be many as it relates to cleaning and gloves and what we're not calling masks, facial coverings, and this hand sanitizer. So I know that Let's Grow Kids is talking with the leadership at Child Development Division. We've also put this request into the State Emergency Operations Center, SEOC, which is part of our outbreak response, and that is the place where they are managing supplies. So I'm super hopeful. I really want you all to know that we consider your workforce a top priority in this response, and the care that you're providing for children of essential workers, it comes up in our operations center every day. So this is a top priority of our efforts. Next slide. So here's this awesome website. I know you don't have tons of free time, but it got so much better overnight. So now when you click on the COVID, you can go straight to a school and childcare page that has all of our resources up to date. You will see that there's an FAQ, which is about the 4th link down on the left there. That FAQ was all the questions you asked after the last webinar, which we answered in writing. We updated it Sunday night with what we learned from the CDC guidance, which is now reflected in the Monday guidance, but we're going to update it again after today when all of your great questions, which I see in the Q&A, when we answer them both verbally, and then, as Sherry said, the ones that we can't answer, we're going to get back to you on, and they're going to be reflected in that FAQ section. Next slide. Oh, here we are. Okay. So Maria, since these aren't my slides, if you want to drop that down, I'll look at I'll start looking at the Q&A with.
So Breena, there's a couple questions about eye protection, and do you recommend eye protection, or what would you recommend if you do?
Definitely. So that's in the new guidance. It can be, I think I really count on you all to think about your kids and what would be best for them. There isn't a lot of guidance about how to cover your eyes beyond just glasses from the CDC. So you can wear glasses, but if you want to wear something more like goggles, or if you have other creative solutions, like I've seen some folks, healthcare providers around the country are wearing, ski goggles, and others, you're welcome to try things like that, as long as I know you'll do, balancing it with how it appears to the children you're caring for. So plain old eyeglasses is enough, because you're trying to prevent the droplet from entering into the mucous membrane around your eyeball. So you don't have to worry about the side of your face. It's the interface with the eyeball.
And Breena, there's some questions just wanting you to clarify again the facial coverings, and should
Yes.
children be wearing them? Do they wear them all day? There also
Okay.
is questions about a concern around wearing them with young, particularly 2 and under, and just developmentally, social,
Totally.
emotional. So that,
So
those
we,
questions.
the CDC was super clear, kids under 2, no mask. I'm sorry, facial covering. They don't comment on 2 and up, and we as a state, with the help of all of your leadership and folks that are with kids every day, we opted to not require masks and facial covering of children in their programs. There's so much I could tell you epidemiologically about children and this virus, but I guess the simplest thing to do when you go on our fun data website is to see we don't have any children under the age of 10 with the virus in the state of Vermont today. I'll just say today, because we're up over 600 cases. So it isn't, we don't have confirmed positives in pediatric patients. We also have tons of evidence from China, from Washington State and other states ahead of us, that there's a super, super, super low infection rate in children, and that when they do have it, they're not ill. So we're not worried about the kid spreading it per se. I will tell you that the mask, I should have said this at the beginning, the mask is an altruistic choice so that you don't spread the virus. It doesn't protect you from getting the virus. And this is super important, because you as a caregiver, and all of us that go out to grocery stores and pharmacies, we might have this virus and we might not know it. And that is somewhat new information. Maybe you've been following that in the national news. In the beginning, we felt better saying if you were sick, you spread the virus. There's evidence now that adults with this virus can have no symptoms. So it's messy and nuanced and messy, but you as a mask wearer are just keeping your own potential spread to a minimum. So that's important. It's not protecting you, it's protecting others. I will say that we know it's going to be hard. We know little kids are going to be in a strange space about it, but we trust you, and we really honor your expertise about the emotional lives of kids, and we want you to talk to each other. We want you to talk to Let's Grow Kids, your child development division team at Know and Care for Kids, talk to pediatricians, call me. Let's just bat this around about how do we make this fun and interesting for kids and also protect ourselves or each other. I think kids are incredibly resilient. They're already aware there's something going on. So you're just going to layer in something else. But I want to hear from you. I'm not minimizing that this is crazy new advice, and it just hit the general public too. So a lot of people in my team are asking about their own mask wearing and facial covering wearing. So if you're out walking the dogs by yourself, you don't have to do anything. It's if you have risk that you're going to run into another human, or if you're out in a public space picking up takeout, groceries, pharmacy, you need to wear a mask. And I don't mean a mask, because I keep botching that. You need to wear a turtle fur or a scarf or a bandana or something that somebody creatively makes for you with hair ties and hair bands. All of that is good enough. And that's super confusing, because in real life, we're always very scientific and, wondering about all sorts of particle movement. And this is just a mitigation strategy to try to stop a little bit of the spread. It's not nearly as important as some of the other things you're all doing with hand washing and social distancing, but it's the next thing we're going to do. And, I should have told you all at the beginning, I'm in a pretty hopeful space today. We're waiting and waiting for this surge that has got everybody prepared and concerned that we haven't hit the crest of these, Vermont's experience with this virus in terms of burden of disease, how many people have it, and then how many people are in the hospital, in the ICU, on ventilators. And we are just, the last 3 or 4 days, it's just stable. It's just a bunch of people with the virus and just a few people really, really sick. So whatever we've all been doing has been working, and we need to not take our foot off the gas on it, not start moving about differently. And I think this mask thing is just another teeny little step. Okay, I probably talked too much about that. But.
Hey, Breena, there's a question about how long should they wear gloves the whole day?
No, definitely no gloves. You wear gloves to take temperature, because it's a clinical procedure. It's part of your routine. But the rest of the day, when you're handling children and you're working with kids, you should just be washing your hands before and after activity, before and after eating, before and after bathroom. And folks have been asking a lot of great questions about just the integrity of your skin and that, the dryness that's occurring and the frequency of hand washing. And it's just, I don't have a lot of answers for you. I just know that it's more important that you live with dry, cracked skin than it is that you risk that the virus stays on your hand.
And there's a question about covering necks and chest or other exposed skin. Is that a recommendation?
Yeah, it isn't. The virus goes into places that are, I said mucous membrane before, apology for the medical term, but the inside of our mouth and the inside of our eyes and the inside of our nose is where it spreads. And I'm sure you guys have seen the videos, but we touch our face all day long. So your neck and chest, and there is guidance in our new guidance. We talk a little bit more about your clothing and just having things you can remove so that you can leave like a loose fitting shirt when you go back home, or if you're in your home when you're moving from the care of children into your regular evening activities, which is just way precautionary. But if you don't have an open wound or anything that's moist, you're not going to spread the virus through your skin. It's the face, it's the touching of your face and the mouth, nose, and eyes.
There's a question about someone has a local sanitation company that will donate portable sinks for entryways, but it's cold water. Is that okay?
Oh, such a good question. It is not well studied, and we prefer hot water. So that's like a party line answer. I think with adequate soap and the full 20 seconds, I think cold is good, because I like that you're thinking about how to have a station. Because the more the hand washing, the better.
Mm-hmm.
It's been a very interesting time in infection control, because hand sanitation is also only as good as, the studies that we have about it, and there are no studies about this virus. But I'm not telling you not to use hand sanitizer. I just think a mixture of lots of hand washing with soap and then lots of hand sanitizer is the answer for this current situation.
Great. I recognize there's a lot of questions about getting essential items, and I'll address that before we sign off, I promise, but I want to get to the other questions that Breena can specifically answer. There's some questions here just around, like, with facial coverings, what if children are touching them throughout the day? Should they change them out? And then a similar question is, if you have a shirt on and it gets, a child drools on it, or should you change? They're just kind of wondering about those things.
Yeah, again, so much of this is not known, so I think we're going to have to work on these together. But I think any kind of moist secretion coming off a kid that gets onto another person, there should be changing of clothing. The notion of kids touching your face and the cloth covering is, if there's been hand washing throughout the day adequately, I don't think you have to be changing the facial covering with the frequency of the touch. I think it's more if it gets wet with a secretion from a drool. We actually talked about drool a fair amount in the amending of this guidance. You guys have such good support through your Crystal Machad and the leaders at CDD. They really thought through all of the stuff that even the CDC really hasn't addressed, and drool is one of them. So if something gets wet with a secretion from a kid, I would change, whether that be a mask or a shirt.
There's two questions about how, like, should they wear eye protection all day?
Yeah, if kids aren't, oh, no sick kids should be in your program, so you're not going to be exposed to the droplets of kids unless they're drooling. And I don't picture a lot of encounters where the drool from a kid is on your eye. But that being said, if you can do it in a safe way and you have a fun pair of eyeglasses that you wear anyway, keep them on. So it's a little bit of common sense on that one. I think it's more likely you're going to get something in your mouth than your eye, but if kids are all over you and they're little and you're doing a lot of engaging, you know, the CDC did try to talk a little bit about distancing from kids and stuff, and they got a little bit shut down on that. I should have told you too that Sherry and I and my team were both part of a national public health workforce with Childcare Aware, because this is a really important space with less answers than we wish. And so we're just all here for you. I think Childcare Aware and the national organizations thinking about health and safety in childcare are not loaded with answers either. And the idea that you would say to not say, but model for an 8-month-old that you're not coming over because you're creating some social distancing is just it's not a reality, and it isn't working. So I'm just with you all on the complexity.
There was a question about if you have like stuffed animals or soft toys, is putting them in the dryer a solution for?
I don't think so. I mean, in some world, you know, there's some mention that you can leave items for a couple of days and then there's no tested virus. Have you guys seen I should just tell you that this virus is known for, parts of it are available for up to 24 hours or longer when it's out on surfaces. But the scientists are saying that's not necessarily disease. That's just little particles, a little piece of the outer body of the virus that's still around. And so that's why I touch my mail, I pick up cardboard boxes, I'm good there because I wash my hands like crazy. But the stuffed animal, it just feels like for this short time, we just should get rid of all those things, because you can't keep them from getting moist. And there's not really great advice about how to dry them.
There's a couple specific scenarios of families, so I'm just going to read them exactly. So this will be the first one. If you have a child that comes from a home with 2 essential parents and one parent has possible exposure, should child attend care? Should the whole family be under quarantine?
Yeah, so here's the whole complexity. Possible exposure needs definition, right? So that person will be told what they need to do as the exposed person. So if it's a healthcare worker that is, I'll just be, is in the room with a person that's with COVID-19 and they cough on them and they don't have protective equipment, that person is completely going to self-quarantine for 14 days. And then the people around them can still have business as usual. But the growing recommendation around this is case by case, because if they could figure out a way to care for those kids differently, everybody should just stay home because it was a significant exposure. But if it's when you say an exposure and it was like they might have been in the room with someone and the test on that other person is pending, it's too many steps down the line and it's not attributable. So that stuff we talked about earlier 2 weeks ago, or maybe it's only 2 weeks ago, there is no attributing anymore. We're not going to be able to look back and say the case of a kid in your program was because you let an essential worker who had been exposed bring that kid to your program. If a kid gets it in your program, we're going to say there were 300 cases there were 60 cases in Addison, and one of them went to Shaw's on Tuesday. I always call out grocery stores on these examples, and it's not fair, but it is one of the only places we're going. So please don't take this as an indictment, because the grocery stores are some of my heroes in this story, by the way. Really great leadership, really great, thoughtful approach. So you'll never be blamed for anything that goes on, but each of the scenarios you should call my nurses, because the nurses are getting so good at, like, wait, what? Like, positive case, or maybe or someone's test is pending, or someone had a cough, or it's not remotely linear, and you guys are stuck in these anecdotes or these rumors, right? Like Johnny, the mom is a nurse, and none of it's turning out to be exactly what is being represented. So I guess for specific scenarios, I'd rather you just call us, because the guidance is changing every day too. And healthcare workers are, a big part of your essential workforce, but they're so protected. I mean, if we're telling the truth, of course I always do, healthcare workers are at risk, there's no doubt, but they have the equipment to protect themselves. But other workers are being less protected from general virus acquisition, right? So in some ways, it's the right group to think about, but it's also all of your groups, all of your parents have had some exposure, because you're in this lane of essential workers. These are people that are out and about, despite, all the other guidance to stay put. I hope that makes sense. We've been timing it. When you guys are calling our nurses, which I'd love feedback on if it's working or not working, our nurses are averaging 20, 25 minutes with you. It's not a boop. It's a, wait, let's pull up the guidance together. Let's think it through to the best of our ability, what we know today on the 7th of April. And then when things are changing, we're trying to get it out to you in a meaningful way. And then we're going to keep doing this with you as well.
Thanks, Breena. There's a question about nap mats, and someone has cots and they spray them down with Lysol and clean them after each nap time, but they're stored in a stack so they touch. Do you have different recommend?
No, if they've been cleaned and then stacked, you're good. All good. I mean, we have to, it's like I said with the outdoor equipment thing is tricky for me. I don't know how we're going to clean swings and climbing structures. And I just know the CDC said you had to do it. And then I want you to know that we know that's a weird recommendation. And so everything we layer in about, do I think kids are going to acquire the virus on a swing link? No. As a medical person, no, I don't. But the CDC is getting a lot of pressure to increase the specificity of their guidance. So that's why they recommended the outdoor equipment cleaning. Yeah.
And Breena, there were a few questions about, and I think you covered this, but I would encourage these people to call the nurses directly, just about they're caring for children of healthcare providers who have direct contact with COVID-19 patients. So I think you did address that in that general, and then they might want to talk to the nurse specifically if they have some.
Yeah, I think scenarios. So what's new today is, those healthcare workers, we should try to have someone else drop the kids. That will minimize your exposure to the person, not the kid, because you're wonderfully exposed to the kid, but the person. If they can get someone else to drop off or pick up. And, Crystal and I and her team, here's another interesting thing. The CDC wanted drop off to be in the parking lot. They didn't want a lot of people entering into programs, homes or buildings. And there's something there that doesn't quite work for the care of children in both directions, right? We want parents to know the environment they're leaving their kid. So obvious, and because not everyone is in the care setting that they were last week, because you guys are so wonderfully, you're setting up care for kids you've never met. It just felt like that's way too strict, that you're out in the parking lot like, hey, I'll show you the place some other time. So that's why the healthcare provider drop off, we could have done it in parking lots, but we liked it better, the recommendation to say, can someone else drop them, the non-healthcare person? If they can't, they can't. And this is the gray zone. And then the other thing, the healthcare providers are in Vermont, and I know you're reading a lot about the national news and it's so scary, New York, New Jersey, Vermont healthcare providers are fully protected. I mean, like truly, like long-term care facility people, if there's even the patients without COVID-19, they're caring for them in full garb, full, the patient protective equipment. So I don't think they're the highest risk group that you're hanging with. I mean, I'm not trying to shift your concern, but I do know that Vermont's in good shape. And we're further along. A few weeks ago, there was exposure because we didn't know who had it, and we hadn't started testing a lot of people, and there were definitely people wandering around ERs with COVID-19. But that's not true anymore. Some of the most interesting data in Vermont, we don't have people going to ERs or urgent care at any rate. There's a few people trickling in, but most of our positives are people already in the hospital or people in long-term care facilities.
Breena, there's a question about what about kids who bring stuffed animals and comfort items from home?
Yeah, they can't. I guess if you could it's too nuanced. I mean, what I wanted to say as a child development person is if you could keep it just to the kid and just for nap so I leave that a little bit up to your judgment in terms of the balance, the same thing with the facial covering that we were saying earlier. There's this little fine, super important line between the emotional health of these kids and the infection control. And obviously we're totally tipping toward infection in most scenarios, but if there is some transition object that is, there's going to be no way that anything can occur without it, then figure out a way to store it safely, or I trust you on that. But I'd rather it be kind of in general, no. Yeah.
There's questions about sandbox toys. Would those be cleaned as well?
Yeah. So presumably those are the part of your outdoor equipment, right? Plastic, shovels, buckets. Yeah, I guess just common sense on that. If you have multiple groups using playgrounds at different times, as described, as we've recommended, a quick wash down in between. And it's going to get nice out too. Like maybe right now this is simpler because kids are running around instead of sitting because it's chilly. But when it's time to just sit and bask, there's going to be more items to clean more frequently. I think some of the questions are coming in the chat as well.
I see a couple questions there's a question. Someone had asked about the number to the nurses, and that is posted in the chat. Let's see. And there was, I think I had one.
Definitely.
There's just some feedback about the nurses in there for you, Breena.
Okay. So it looks like in general it's okay. That I think earlier someone said they didn't hear back. They talked to a nurse, difficult to reach. Okay, so Katie in particular, I really would encourage you to email me directly with the circumstance, because I will tell you, like all things with this response, there have been some glitches. I think I told you the funny story. I like humor in this hard time, that one of our nurses was talking for a long time to someone and realized it was a veterinarian seeking some information about rabies. It had nothing to do with childcare.
Oh, geez.
But and then another one of our nurses was talking to one of you for a long time before they realized they were talking about pinworms, not COVID-19, which I loved. I mean, I would so much rather be talking about pinworms right now. So,
or lice. Remember when lice seemed like the end of the world?
I just want to talk about, or maybe just reporting your immunizations. Remember when that was a big pain in the neck? So for Katie or others, if you're not hearing back, I'm going to say, because I'm so confident in my staff, that there's a glitch and you should call back and bug them, because they're reporting to me at the end of every day. They're getting 6 to 7 calls a day. Today that could triple, right? Because the new guidance is just a little more nuanced, and so's the virus, right? I feel like we're all together in a big muddy pond. And the healthcare professionals are in a muddy pond too. It's kind of a shared understanding of lack of understanding, which I'm happy to navigate with you, but I want this nurse line to work. So if it isn't working, I need to know.
And I think there's one more question that someone put in. Could we soak the items in warm water and bleach and letting them dry outside? I'm not sure what that.
I mean, that's a reasonable cleaning thing if you're talking about like the sandbox toys and things. I hope you're not talking about stuffed animals. it's such a funny, like, this is like a pediatric mama thing because I raised 3 kids. Like, the stuffed animals are, I loved them, but they're just like what we call a nidus of infection. I could never feel safe about the drool on stuffed animals. And one of my sons used, they chew the corner of the ear of the stuffed dog, and you just knew it had every virus. So, but yes, you could bleach and put stuff outside, and there's tons of guidance in the guidance of the guidance about the actual cleaning and the products. And this is where Sherry and CDD are really committed to you all. We're going to get you loaded up if you're not already. Cleaning.
Breena, 2 more questions before I talk about the resources. One is about when the stay-at-home order has been lifted, would this guidance still stand? That's one of the questions.
Oh, it's such a good question. No. The minute we shift into the downslope of this curve, and then we're starting to wonder how to get back to business as usual, I will be right with you, with the CDC and my team, to start figuring out where we can bring back business as usual and where we need to still do some of the mitigation. And it's so nuanced, and no one knows what we're going to do, but it's going to be, there's going to be tons of best thinking. And we're behind China, we're behind Italy, we're behind Spain, we're behind Washington State. That's about all. We're right about New York, New Jersey, if you epidemiologically, not the volume, but the timeline. So I think, in May, we're going to start saying you can start to do a few more things. And I can't really speak to which of the things we're going to drop, but you could kind of predict it's going to be the stuff we just added. So I'm super hopeful the first thing to go is the facial covering. But let's see, because, this is such an interesting time. I did tell Child Care Aware they were asking for feedback on what would be helpful from their perch, because they're smart and they have tons of people. I want this to lead to a long-term health and safety, authentic, funded, body of work that some of you lived through back in the 90s when we really did put all of the health and care of children together. And because to me, we haven't been managing infection quite right as a country, right? I mean, we and I feel terrible for you guys. I felt this way in pediatric healthcare too. Like, we just sort of normalized the kids that with runny noses, terrible cough, just, they have to still go to care because their parents still have to work, and because we don't give people paid leave and we don't have adequate sick time. So there's a cascade here that I think we're going to piece our society back together, maintaining, doing some of the stuff we wish we could have done before. Interesting.
There was a suggestion in the chat box, more than a question, about that you could do drop off at the playground as a way.
By the way, that's what we love about Vermont. You guys are so creative. If you have any ideas like that, just try them. Within these frames, we've now told you that we think it's safer for kids to be transferred back and forth outdoors, but we also don't want families to be excluded from the physical space. That's I can't picture that as a parent.
Yep.
You can't come in. That means you don't even know where your kid's playing all day. No. So balance all of that. Try some stuff. Think about all your essential workers as carrying some risk, so that you're not like carving out healthcare workers as people with potential higher risk. It's probably not true right now that they have higher risk. It might have been a few weeks ago.
Makes sense. So I think we've gotten to all the questions. There has been some questions here about trying to procure the essential items that people haven't been able to find, gloves, or where they can get facial coverings or masks if you're not a do-it-yourselfer and know how to make them. So I'm going to, Let's Grow Kids is then working on getting programs that are only those programs that are open for essential persons care, resources that they're lacking. And we had sent a collector tool around about a week and a half ago, and we had over like 63 programs identify items that they needed to continue or to reopen to provide care for essential persons. So that is, we can still do that. I'll just tell you where we are right now. We're in the process of fulfilling those first 63 orders, and we're going to do that throughout the week. and we are providing items like hand sanitizer, paper, some toilet paper or paper towels to get people through, um, disinfectant wipes, sprays, things that you need. And we also do expect facial coverings to come in this week, as well as gloves by early next week. So those are some of the items. What would be best at this point, if you have some essential items that you're not able to resource right now, is to send an email, and I'm going to give you the address for that, and it's Jen, Jen, and then the letter S, so Jen S, all one word, at letsgrowkids.org. So I'll just say that again. I couldn't type in the Q&A because I'm the host. I can only answer. So that's why I'm doing it. Oh, and Maria put it in the chat box, but I'll say it again. Thank you, Maria. So it's Jen S at letsgrowkids.org. Send Jen an email about what are the items that you immediately need, and she will put you in the queue. We will start fulfilling orders again next week. And I just wanted to say that what we're really trying to do is to find a resource for you then by the end of April that you can get the things that you need. And Let's Grow Kids will step back from being a distribution center, because honestly, it's not the best thing we've ever done, but it's good. We're doing good. We're learning the shipping industry and lots of things, but we're just really we understand that you are challenged to get the resources you need. Providing Carol Day, many of you didn't have big distributors dropping these things off to you. Some of these things you didn't even need 3 weeks ago. So we're gonna do the best we can to get you everything you need until we can match you up with a resource that will be there for you going forward. So again, Jen S at letsgrowkids.org, and we will do our best to get you things in a timely manner. And we're doing a pretty good job getting things out to people. So connect with us there.
Yeah, let me just maybe when I talked before about the State Emergency Operations Center too, I think that Donna and her team, Crystal, Melissa Regal-Garrett, they're going to know shortly sort of what that stockpile is and how it's going to be distributed, so that I kind of feel good about that. I feel like it's an 8 times 8 ways thing, and you're going to end up accessing supplies from a variety of sites. Because I hope it came across, I wanted to just say again, like, what you're doing for the state right now is paramount. Like, there are a bunch of buckets of work to get us through this epidemic, and one of them is you. And that's why we're so committed to you as public health, in terms of our staff answering your questions, doing these webinars. But you've got a whole state operation team behind you that is so grateful, and so and you know, maybe that hasn't always been the case, that you feel like the top priority. So I want you to really hear that. And maybe that's another silver lining, that now that we understand how essential you all are, we can maintain that when this is over, because it's so true. And then I just nuanced some of the chat box stuff. I did want to make sure you understand equity. You guys are pointing out all the stuff that worries me, that we're saying, hey, have someone else drop your kid off. It's safer, except I'm a single a person's a single mother, and they have absolutely no choice. That is so where I want to live as a workforce together with you, is please know these guidance, it's just guidance, and you need to work on the individual basis with the families, how well you know them, or what you know to be their circumstance. And the other example, when you say only one person should go out to the grocery store in a family, like, there are so many people that they're only themselves, and there's no protection from viral exposure when you have to go. So I don't like that part of our, but it's still just, we're trying to get like the masses to do behavior change. And I do think the guidance has to be case by case. So thank you for always remembering that, and remembering that kids and families don't all have the same opportunity. It's not true.
There was a question about if part 1 was still available, and it is. It's on the Let's Grow Kids website. I think, Donna, is it also, I think CDD also has a link to it that goes out with some of Crystal's, when Crystal does updates. It's on the
health department website too.
It's on the health department website.
I would caution you, you're welcome to watch it. My hair looked better that day. But I would caution you though, because so much just changed. Like, it might be confusing to watch part 1. I think we pulled the best of part 1 into today. I could be wrong, but just caution, it was a different time. I think it was the 24th of March. Like that was
Yeah.
literally
Seems
a
like
year
forever.
ago. A year ago.
So I do want you to know, just before the webinar started, we posted the slide deck on the Let's Grow Kids COVID-19 resource page, so you can access that immediately. Some people were asking what items are available. It's really the stuff that you need to follow health and safety guidelines. So it's like the soaps and sprays and disinfectants and gloves and facial covering. So it's those type of items that you need to provide essential care. And someone wanted to know, how do I know how much I need? Well, you just sort of like, how many staff do you have? How many kids do you have? And, you know, we've been using those estimates when we've been sending items out, is kind of looking at, and like I said, we're trying to help people get through that short term, you know, till through the end of the month anyway, until there are better resources for you, so you don't show up at 6:30 to the store and there's nothing left to clean your program with, or paper towels to wipe things down. So we're just trying to, until we can find a great resource for you, get you what you need in the meantime. Oh, somebody had asked, oh, I forgot this question. Thank you, Katie. The guidelines included a recommendation to do emergency drills every day? Every week?
Well, it started out every 2 days, and then we kind of morphed it to each week. That is a guideline and a recommendation, and it was made by the Division of Fire Safety with the thought that if staff are going out sick and other staff are coming in, that they wouldn't necessarily know what to do in an evacuation. They're not recommending that it be done with children that often. They're recommending the staff practice it without the children. So just so that they know where they're bringing children, especially if they're, you know, they're not, maybe they haven't been working in that program, or the children are new, so that they're relying on the staff to bring them where they need to go. So that really is why that recommendation is there. So again, it's a guideline. So if you know that you've had the same staff and you've practiced it, you know, you don't necessarily have to do it every 2 days, but I think just because we know in this situation that there are sometimes different staff coming in and out, and also different children that are used to that environment, that just keeping that thoughtfulness of practicing that a little more. And again, it's not necessarily with the children, it's just the staff practicing.
Thank you, Donna. So I think we have all our questions answered. I want to thank all of you for providing this essential care. I'm sure, I just can't even imagine the role right now that you're playing in these essential persons' lives, that they can have their child with you and the support you're giving them, and children that you're caring for. So thank you so much for stepping up and doing this important work. And thanks for Donna for being with us from the Child Development Division, and all of everything that they're managing that comes flying at them probably every hour. And Breena, thank you again for joining and being available and setting up the nurses as available to the field as well. It's a really important topic, and it's great for people to be able to have a place to ask their individual questions that during this time.
Absolutely, we're here for you. I do see more nuance in the questions. I think what I do want you to, the drooling of infants and toddlers and changing their outfit every 15 minutes is not common sense. So just take it and then try to amend it as it relates to your understanding of kids. And that's the same with the facial covering. If you want resources, Sherry has a video. We've been hearing from a lot of people around the country about how to make this okay for kids, but we also knew that you would know how to make it okay for kids. So let's, if you want more resources, let me know. Otherwise, tell us what you're doing and we'll share it with others. I'm so grateful. So talk to you again really soon.
Thank you, everyone.
Bye.